Well, hey guys, today let's talk about why it is you've got dry skin in the ears and how to get rid of it. Dry skin in the ears is something that's annoying to deal with. It's irritating, quite literally, flaky, and sometimes, frankly, it can be very painful depending on the underlying cause. Now, when people ask me, how do I get rid of dry, flaky skin inside of my ears? As a dermatologist, the way I approach this problem is, what is the primary issue going on? There are a variety of causes, culprits, to explain why one might have dry skin in and around the ears. Dry skin can affect any part of the ear. It can affect your earlobe. It can affect what's called the helix, this part of the outer ear. It can also affect the conchal bowl, which is the little concave space on the outside of your ear. It can involve the ear opening and the ear canal. That's the part that you can't quite see that is beyond the ear opening and goes all the way back to your eardrum, aka your tympanic membrane. If you didn't know, October is Eczema Awareness Month. There are a lot of different types of eczemas, and many of them can involve the ears. The first being atopic dermatitis, a chronic inflammatory skin condition in which you have recurrent eruptions of itchy, flaky skin that can involve pretty much any body surface, and it comes and goes. It's due to an impaired skin barrier. Guess what? It frequently can involve the ears, especially the junction between the earlobes and your facial skin. This part right here, for people with atopic dermatitis, frequently can become involved, and it gets dry and it gets cracked and fissured and very painful. The eczema can then go on to involve the entire ear and even inside of the ear. Atopic dermatitis is frequently triggered or exacerbated by exposure to certain things like aeroallergens, dust mites, things that come in contact with the skin, dry weather. All of these can aggravate atopic dermatitis. Consistent moisturizing, using mild, gentle cleansers, running a humidifier at night, all of these can help the skin barrier in people who have atopic dermatitis, and that can help with resolving the ear dermatitis. When the ear atopic dermatitis is really flared up and you've got red, raw, cracked fissures, especially plain petroleum jelly can be very useful for healing and allowing the skin barrier to recover. Number two is another type of eczema that we talk about a lot on this channel. It's called seborrheic dermatitis. This is a chronic inflammatory skin condition that is actually related to the immune response to yeast that naturally lives on everyone's skin. The yeast is called Malassezia. People who have seborrheic dermatitis, they also have seborrhea, which is a fancy term for oily skin. And seborrheic dermatitis is related to and often coincides with and is caused by the same issues as dandruff in the scalp. With seborrheic dermatitis, you get these patches of pink, red, flaky skin, and the flakes kind of have this yellowish, greasy look to them. If you have a deeper skin tone, seborrheic dermatitis actually can lead to inflammation that changes the color of the skin and can take away the color of the skin. It's called post-inflammatory hypopigmentation. Because seborrheic dermatitis is related to that little yeast, that yeast thrives in moist, humid environments. So a scenario that can really lead to aggravation of seborrheic dermatitis around the ears is if you're someone who enjoys wearing earmuffs in the wintertime or hats over your ears. If you wear headphones, especially like in the gym when you're sweating a lot, that can create a very favorable environment for Malassezia, and your immune system will rebel against that, and you may get flares of seborrheic dermatitis behind the ears. How do you control flakiness in the ears related to seborrheic dermatitis? Well, start by using an anti-dandruff shampoo to cleanse the skin around the ears and behind the ears. Anti-dandruff shampoos contain ingredients that either reduce inflammation or tackle the little yeast, Malassezia. These include zinc pyrithione, ketoconazole, selenium sulfide. Now you want to be careful not to get these in the ear. Just use a little bit to cleanse around the ear. Other treatments that can help seborrheic dermatitis include topical corticosteroids, which are prescribed by your doctor to get rid of the inflammation for the short term. Also, calcineurin inhibitors. These include tacrolimus, pimcrolimus, which otherwise go by the brand names of Protopic and Elavil. Reason number three, probably more common in the elderly, is something called asteatosis. Basically, when you get older, your skin produces less oil. It doesn't retain moisture as well. Your skin barrier does not make the natural moisturizing factors as robustly. You're more prone to water loss. And this can be aggravated seasonally in the wintertime when the heater comes on, it can dry out the air and that can lead to more water loss from the skin, exacerbating this problem further. In the case of asteatosis in older adults, or anyone, I mean really anyone can develop this, but older adults are more likely. Addressing trigger factors like dry air with the humidifier, making sure that you are not over-cleansing the area. Over-cleansing will strip away the skin's natural moisture barrier, which to begin with is already an issue in older adults. And make sure to use a plain petroleum jelly to allow for trapping of water in the skin, reduction of transepidermal water loss, and importantly to limit penetration of irritants into the skin, which is an issue when you have an impaired skin barrier, whether it be related to atopic dermatitis, seborrheic dermatitis, or in this case, asteatosis. Reason number 4 is another eczema called contact dermatitis. Contact dermatitis, basically what it sounds like, a dermatitis or an eczema that happens as a result of things that come in contact with your skin. Contact dermatitis comes in 2 flavors. One is irritant contact dermatitis, in which things are simply irritating to the skin. Maybe they disrupt a lipid barrier. Or you can also develop an allergic contact dermatitis, in which you are allergic to something that might be coming in contact with the skin. And every time you come in contact with it, you develop a rash. So talking about irritant contact dermatitis around the ears, you can develop irritation as a result of products you are coming in contact with, especially hair care products, shampoos, conditioners. While you're shampooing and conditioning your hair in the shower, might get on the ear and disrupt the skin barrier, especially if it's not getting rinsed off. I always caution to not use too much shampoo. The ear can be a bystander from overzealous use of shampoo, so make sure you're conservative in the amounts of shampoo that you are using. You don't need huge fistfuls of shampoo to wash your scalp, so don't overdo it there. You also can develop irritation from hair styling products. That includes hairsprays, hair mousses, gels. But let's talk about allergic contact dermatitis. That's very different from irritant contact dermatitis, because with allergic contact dermatitis, what happens is your immune system develops a vendetta against a certain ingredient or substance, if you will. That can be in a skincare, hygiene product, a cosmetic, or it can be in a vast array of other things that just come in contact with your skin. Don't underestimate the power of nickel to ruin your life. Recently, I did a video on eczema trigger to avoid, and we talked all about nickel and why it can be very problematic for people with all different types of eczema. Nickel is one of the most common allergens, contact allergens out there. It's frequently present in jewelries, earrings, earring backs. You have to be really careful. You can also develop an allergy to perfumes, soaps that you may be using, certain ingredients like fragrance, for example. Hair care products, for example, oftentimes when I go to the Dollar Tree, I'm always pointing out those preservatives, methyl isothiazolinone or methyl chloroisothiazolinone. Those are common allergens, often in shampoos and conditioners, but can be found in other products. And in terms of shampoos and conditioners, patients who develop an allergy to that, they often will develop an ear dermatitis as the products are being rinsed off, come in contact with the ear. Itchy, flaky. Hair dye. The most common allergen that's going to be encountered in hair dye is paraphenylene diamine. Some people are allergic to certain materials found in helmets, so the helmet may come in contact with parts of your ear, trigger an ear allergic contact dermatitis. Elastics, for example, in a shower cap or a hair bonnet. Some people develop allergies to certain rubbers and things and elastics, especially when the elastic starts to get a little worn out. The allergen becomes much more obvious to your skin and gets in more readily. So that's something to be aware of. If you sleep at night with a bonnet in close proximity to your ear, that could actually be the culprit right there. Doesn't necessarily have to be things that are coming in direct contact with your ears. They can come in indirect contact with your ears. For example, a lot of people develop allergies to certain ingredients in nail polishes or artificial nail glues, and the fingers at first aren't really bothered by the allergy, but you transfer the allergen to your face, your ear, and you can develop rashes there too. Interestingly enough, poison ivy often presents with an ear dermatitis, like the earlobe can often be involved. Getting back to allergy to nickel and jewelry, I have a whole video all about how to choose jewelry or what types of jewelry to avoid if you are allergic to nickel. So definitely check that video out. I give a lot of tips about the different types of metals and metal alloys out there that you need to avoid if you're allergic to nickel. That's going to be really important if you are developing an allergic contact dermatitis on your ears to nickel to your jewelry. Here's a condition that I want to talk about that can involve the ears with a lot of flaky dry skin. It's called otitis externa. You may have commonly heard of this referred to as swimmer's ear because it is very common in people who swim, but it can happen to a lot of other people as well. Basically, it presents with flakiness, redness, irritation inside the ear, and ear pain. You can even have some oozing coming out of the ear of like fluid or malodorous substance, depending on how severe it has gotten. Excessive moisture is the root cause. I've talked about this in other videos, but water is a skin irritant. Left on the skin actually can irritate the skin barrier quite a bit. Now, your ear canal, that's what is beyond, if you look at that ear hole, inside your ear, that dark black hole, going back, that's your ear canal, goes to the tympanic membrane, your eardrum. Earwax is this substance called cerumen. Earwax comes out and it lubricates that canal, and it also moves along in a fashion so as to pull dead skin cells out from the ear and to shed them out through the whole of your ear. Earwax is actually a really good thing. It is part of your body's natural cleansing mechanisms. Earwax contains compounds that reduce bacteria. Earwax also helps protect that ear canal from water, and it also helps control the pH of the skin there so as to reduce colonization with bacteria. What happens when you get too much water in the ear canal or other conditions, which I'll get into in a moment, is that it can disrupt the amount of cerumen wax there. And that can make it so that water gets in and collects there and causes maceration. Basically, it's a very tight little space in there, so water gets in there and it can overhydrate the stratum corneum, the skin inside of the ear, and lead to swelling, irritation, and secondary infection inside the ear, in that part of the ear canal. For people who have a weakened immune system, this actually can be life-threatening, and that includes people who have diabetes. It can be really, really deadly because the bacteria can basically get in through the skin and invade and get into the bone. I mean, it can be life-threatening. While earwax is generally a good thing and lubricating that surface and pulling dead debris out, some people make earwax that's really thick and hard and dry. And because of that, it can get impacted sometimes and interfere with the flow of shedding skin cells, and that actually can cause problems for you, including, temporary hearing loss, and can actually make this problem more of a risk for you of otitis externa, involvement of the ear canal. So obviously swimmers are an at-risk group. They get water in their ear, but it also can impact people who live in very humid climates, who sweat a lot during extreme heat and high temperatures. Because earwax is so important for controlling things inside the ears, one risk factor for developing otitis externa is actually putting Q-tips in your ear or other things like your fingernail or bobby pin to try and get earwax out. I'm always cautioning in my videos, don't put Q-tips in your ear. The reason is that what happens when you put Q-tips in your ear is that you push the wax back and it gets compact and it disrupts that natural flow of pulling things out. Because of that, you don't have that good protective effect. You're not pulling out the keratin debris, and it can lead to a favorable environment for bacteria coming in and causing an infection. Not only that, but a lot of people who put Q-tips in their ear or other things in their ear to try and get the wax out, unfortunately, a lot of times they accidentally hit their elbow and end up puncturing their eardrum. It goes too far back and they puncture their eardrum, and that is not pleasant to deal with at all. Now, we talked about a lot of eczemas in this video already, but having a variety of different skin conditions like eczema, whether it be atopic dermatitis or seborrheic dermatitis or contact dermatitis, actually puts you at risk for otitis externa because, again, a lot of times you have inflammation, you have skin cell turnover problems, flakiness. That stuff can collect in the ear canal and put you at risk for this. Another condition called psoriasis, where you have a skin cell turnover problem, also can lead to otitis externa. I talked about how wearing headphones or earmuffs creates that moist, humid environment that's hospitable for malassezia and favors seborrheic dermatitis. But it also is a situation where you could be putting yourself at risk for otitis externa if you're wearing these things all the time, especially in a hot, humid environment, especially if you have one of these underlying conditions that I just mentioned, like atopic dermatitis, seborrheic dermatitis, or psoriasis. Not only the headphones or the earmuffs or whatever, but also things that you put inside the ear, including hearing aids, unfortunately, they can cause a lot of irritation, especially if they're not fitting you well. The other thing is earbuds. People are putting all sorts of things in their ears these days. 30 years ago, people were not walking around with earbuds in. So we're seeing an increase in otitis externa related to these things. And it's just something to be mindful of. It can really aggravate the skin inside your ear and cause flakiness and frank problems for you. Another skin condition that can lead to flakiness inside the ears that you may not think about is actually lupus. Now, lupus is an autoimmune disease, and there are a variety of types of lupus that can affect the skin. The most common way in which lupus might affect the skin is something called discoid lupus. And discoid lupus is a inflammatory skin condition where the skin can scar down, and it can actually disfigure the person, lead to permanent scarring. And it frequently involves the ear, especially the conchal bowl, that little bowl inside your ear. And with discoid lupus, you get these flaky, dry, discolored patches of skin. And often it almost looks like they have these really prominent pores. Sometimes even look like they have blackheads. That's called follicular plugging. Very characteristic, and it can lead to discoloration, hyper and hypopigmentation. Discoid lupus is a lot more common in deeper skin tones, but discoid lupus of the skin, we go about treating it in a variety of different ways, depending on overall extent. That includes steroids to suppress the inflammation that comes into the skin in the areas affected by lupus. It can be a steroid cream, a steroid ointment, or it can be an injection of steroid directly into the skin. Calcineurin inhibitors we talked about earlier can also be used to treat lupus of the skin. Many patients with discoid lupus end up taking a medication by mouth called an antimalarial because it's used to treat malaria. For example, hydroxychloroquine is used to treat lupus. There are a variety of other medications that can be used to treat discoid lupus, like methotrexate. Systemic retinoids like isotretinoin actually can help a subset of people with discoid lupus. If you do have lupus, it's important that you not smoke. Smoking makes lupus much worse, and it also makes it much harder for the medications to actually work if you are smoking. The other thing that is key with lupus is aggressive sun protection. Patients who have lupus are sensitive to the sun. Sun exposure can aggravate all the symptoms of lupus, including the skin rashes, because basically with sun exposure, whatever it is that is going on with your immune system, it gets very revved up. Certain things are exposed in the skin after you go out in the sun or your skin sees UV light. Certain proteins and things get exposed in the skin, and your immune system doesn't like that, and it reacts in all kinds of ways. So it's really important that if you do have lupus, you're really, really diligent with your sun protection because getting sun can make you very sick. And that includes sun that comes through the window. So you need to be careful when you're inside, you're not close to a window, or if you are, you're wearing a broad spectrum sunscreen and sun protective clothing. People who have lupus, they, usually have a good sense of sun protection because they know firsthand how poorly it can make them feel, and how, their skin problems can get significantly worse. All right, y'all. So those are the, kind of conditions that we think about when it comes to why you might have flakiness in and around the ear. Now, let's talk about the ear canal. You don't want to go putting moisturizers in the ear because it's a tight space, and your body has, again, the wax. It's kind of like it's like a natural moisturizer. So you really don't want to go putting stuff in there. But there are some situations where your earwax may be hard and impacted in there. So how do you get rid of earwax and help it come out naturally without it like being all over the place or too hard and stuck in there? Instead of using a Q-tip or a bobby pin or something to push it back further, which is a bad idea, again, it's going to make the problem worse. Compact it in there. It's not going to allow it to lubricate the ear surface to cut down on bacteria. It's really not a good idea. So but how do you get rid of it? Easy thing to do is to go to the drugstore in the laxative section and get yourself a bottle of mineral oil. Heat it up a little bit, not hot, but just get some mineral oil and get it to a warm temperature, just, you know, in some glass in a microwave. And then all you need to do is put 1 or 2 drops of mineral oil in the ear. Tilt your head to the side. It's actually very relaxing. Just let it get in there and coat the ear canal. And what that will do is it's almost like oil cleansing. It will break up that hard wax and allow it to come out more easily. If you're someone, especially who is prone to making harder earwax that gets impacted in there. You know, they also sell kits and things to remove earwax. A lot of them have peroxide in them, which helps break up the wax, but it also can be pretty irritating to the skin inside the ear and can end up kind of creating this vicious cycle for you, especially if you have like atopic dermatitis and you've got a lot of, you know, skin barrier problems, skin cell building up in there with the wax. So the mineral oil is a more practical and safer approach to that. The other thing though, when it comes to buildup of earwax in the ear is you may need to see an ear, nose, and throat specialist because they do something called oral hygiene, oral, A-U-R-A-L, as in ear, not oral as in mouth. And they actually can go in and remove built up wax in the ear, impacted cerumen, impacted wax. But they don't go in there with a Q-tip to do that. They have a special tool to look inside your ear, and they have this suction device, and so they're able, you know, it's like they're able to basically pull out that wax. And if you've got impacted cerumen, it's not pleasant, and it will impact your hearing. So that's, as a side note, you know, we're here talking about dry, flaky skin in and around the ears. But if you have a child, I'm just going to tell you right now, if you have a child who is struggling in school or, you know, having difficulty focusing in school, think about earwax, because this is something that happens to kids and it goes missed. And sometimes they get diagnosed as having like learning difficulties, behavioral problems, attention problems, when in reality it's earwax that is affecting their hearing. And once they have the earwax removed by a specialist, it's like it reverses the problem for them. So if you have a child that you're taking care of who is having some difficulties at school with behavioral, I mean, there's a whole host of reasons why that might be. I'm not saying it's earwax, but think about earwax because it's something that goes missed and it's very easy to correct. It doesn't require medications. Just, you know, see the ear, nose, and throat doctor. They have a special setup, and it really can make a huge. Bring it up with your doctor. Like, could this be earwax in there? Have them look inside the ears. It really could be the root cause of their problems, and it makes a huge difference. All right, y'all, those are reasons why you might have dry, flaky skin inside the ear and what to do about it. I really hope this video was helpful to you guys. Now, on the end slide, I'm going to link my recent video all about eczema trigger to avoid, aka nickel. So check that one out next if you missed it. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.